Good morning. We will be getting started here in a couple of minutes. Thanks for your patience. Good morning. We'll get started in another couple of minutes to give folks a little bit more time to join. All right, Curtis, I am showing that we are 1 minute after the top of the hour. You ready to go? I will kick us off.
That sounds good.
All right, perfect. Good morning, everyone. Welcome to the December 2020 TECB webinar. I'm Molly Falls, and I will be supporting this call today and will help moderate if there's questions that come through. Today, Executive Director Curtis Sutton will be talking about 2020 and what's to come in 2021. We definitely appreciate your time and attendance this morning on yet another Zoom or GoToMeeting webinar. I think we're all hopefully, or I know I am, a little burned out of these webinars using the webinar platform. I miss seeing everybody in person. So hopefully we can get this vaccine rolled out and we can start seeing everybody sometime in 2021. Before we get into the details of the webinar, there's a few housekeeping items. So right now, you'll be in listen-only mode, and we currently have that planned to be set that way until the end of the webinar. If you'd like to ask a question and be unmuted, you can raise your hand and your phone line will be unmuted. If you have questions that you'd rather just submit in the questions, there's a chat feature and a questions box right over here that will allow you to enter a question for the staff. We also received a number of questions in advance, thank you. So Curtis will address those towards the end of the presentation, if not throughout the presentation. And with that, Curtis, I'm going to hand it off to you.
All right, well, thank you. We wanted to do a couple of things today, basically go through our 2020 activities and give you a preview of our 2021 activities. So I appreciate all of you joining. I know that December is kind of a busy month for everybody. I'm in the one corner of my house that is not taken by kids that are doing school at home due to the COVID pandemic, and not covered with wrapping paper or other things. So this is the only place I've got to actually sit and do these things. So I know it's a busy time, and I appreciate you all taking your time to join us today and kind of get a feel for what the board has been doing and where we're going to be going. What I want to do first, though, is introduce you to our staff. I know that we've had a lot of new people that have come on. If we could advance the slide. So we have a staff, we normally have a staff of 8, but right now we have a staff of 7. Other than myself, we have Benjamin Glover, who's our general counsel and assistant director, Vanessa Williams, who's my primary assistant, Barbara Shank, our accounting technician, Ann McDonald, our director of government and external affairs, Jim Barnes, our fiscal director, and Eddie Burchell, our director of technology. Jameson Peavyhouse was our training coordinator. He has moved on to bigger and better things, and we will be working to fill that position very soon, we hope. We can go to the next one. So one of the things we come up with, and as part of our strategic plan, when we were going out and developing that, we decided to put pen to paper and write down our mission, our values, and explain that in a concise way. So this is just a little refresher of our mission and values. And just to let you know that the board and the staff are committed to our mission of ensuring that the public can access the life-saving power of 911 and our values of integrity, leadership, and accountability. We are very proud of what we do for the state of Tennessee, and we want to make sure that we're providing leadership in 911, not only in Tennessee, but nationally. But we also want to make sure that we're doing it with integrity and accountability. This is something that is very important to me, and it should reflect in everything that the board and the staff does. So our next slide, please. So to give you an update on our 2020 projects, basically had 4 major things going on. Our NG91 transition to AT&T's Esinet, our text to 911 and call handling as a service training, and then our NG911 grant. So for our AT&T nationwide transition, we're on track to deploy about 74 PSAPs this calendar year. And we want to say a thank you to those districts and PSAPs for helping with the data collection, the scheduling, and other steps involved in transitioning to that network. We signed an amendment for Transitional Data Management Services, or TDMS, which will help ECDs transition to a geospatial master street address guide, or MSAG. AT&T will do the management of that MSAG in the background, and there will be more about this service as we kind of enter into 2021 and have more districts transition to that Esinet. With text to 911 and call handling as a service, or otherwise known as CHAZ, with the nationwide transition, we've seen a good increase in the number of PSAPs that are text ready. Text ready means that they are ready to work with the wireless carriers to deploy text to 911. And unless PSAPs share their information with us, we're not really sure of how many districts have text 911 live in their districts right now, but we do know that there are a number out there. I think right now we're aware of 9 districts that are actually providing live text to 911 services within their jurisdiction. In the past year, we've had 11 PSAPs that have gone live on the call handling as a service, and we're now at 106 seats on that platform. We have more deployments planned for 2021, and encourage you to take a look at that if you're in need of a controller. With that call handling as a service, you avoid your depreciation costs, and the folks that we have deployed it with have had some really good things to say about it. If you need to talk to any of those folks, you want to get a review of that platform, please let me know, and I'll put you in touch with somebody so you can actually go to their center and see how it works. For training, in the past year, we've had 4 in-person training courses, which is amazing. Consider that we've been locked down since March. So we appreciate you all that have participated in those courses, and we hope to provide more in-person courses in 2021. We had a contract with NENA, the National Emergency Number Association, to do those. That contract, I believe, has expired. So we're looking to see what our options are for in-person training courses. But we'll provide you with some news about that as soon as we have some. For Virtual Academy, we continue to see great numbers for Virtual Academy. Just over 9,000 courses were taken through the week of December 1st. So it's just been an amazing project for us, and we hope to continue that growth as we go into 2021. We did have the TCPR course, the telephone CPR course that was launched in November on Virtual Academy, and we saw over 600 telecommunicators complete the course in 1 month, which is absolutely amazing. And those that took that course should absolutely be commended for doing it so quickly and getting ahead of the January deadline for taking those courses. Then our NG91 grant program. So right now, we are providing cybersecurity assessments for all districts using the grant funds. We've seen some really good engagement from the districts and have had 56 assessments that have been completed so far. We really want to encourage you to take advantage of that cybersecurity assessment if you have not already. The feedback that we have gotten from our districts that have taken advantage of it has been overwhelmingly positive. And the operations committee that is actually looking at the revenue standards, the policy committee that's actually looking at the revenue standards is going to make a recommendation to the board in February that cybersecurity be part of the required uses of 911 revenue. So we would highly encourage you to take a look at that offering by the board. And if you would like some more information on that, please get in touch with me or Eddie, and we can provide that information to you. Okay, if we can go to the next slide, please. So our contract with AT&T for NG911 over NetTN will expire in 2023. And what we're trying to do now is put out an RFP for an NG911 network after that contract expires. We're hoping to have it by early December, but it's still working through the procurement process at the state. So at this time, we don't have an exact date for when that RFP is going to hit the street. But after its release, we will have about 6 months before we get to contract negotiations. Since our contract expires in 2023, we will need to have the full transition complete by that date in the event that the award goes to a new vendor other than AT&T. So we've gone through some steps to get to where we are right now. We went out to the ECDs, had some road shows, developed some requirements. We met with several potential vendors to do some due diligence on current offerings that are out there right now, what their features are, what sort of things that we would want to include in our RFP. And then we finalized our requirements, submitted those to the operations committee, and then finalized an RFP internally and submitted that to the state. So right now it's still going through the state procurement process. This will be a very large contract, probably one of the largest that Commerce Insurance has ever had. So it's taking a little bit. It's taking longer than we'd like, but hopefully we'll get some news on that very soon. Okay, next slide, please. So what are the benefits of NG911 2.0 as we're referring to it, what we will get after 2023? Well, you'll have some improved NOC support. You'll get some more redundancy and resiliency. We'll have policy routing, better security and cybersecurity. we'll have some artificial intelligence that will allow for call overflow or PSAP abandonment. Service level agreements, we're including those in the RFP. It will be a scalable system that will be able to adapt to our needs. And we'll have some advanced GIS as well as maintaining a call handling as a service or hosted controller type system. So this basically brings us to our next evolution of NG911. And we use the feedback that we received from you all from our gathering information when we went out to do the road shows and our meetings with the vendors to develop the RFP, and just want to take a moment to give you all some of that, some of those benefits that we gathered from you and from them to highlight the features that you'll see in NG911 2.0. Okay, next one. So we also have another RFP that just hit the street. It's a spatial interface RFP or GIS RFP. So True North has been providing services to the board through the existing contract with Comtech. That contract will expire in January. However, the services that True North have been providing to us have been critical to supporting the districts in managing GIS data. We released the RFP on December 11th, and we plan to have a provider hopefully by the end of the first quarter of next calendar year, 2021. In the meantime, what we're doing is working with True North to secure a month-to-month arrangement, and we believe that that arrangement will be finalized very, very soon. So we hope not to have any sort of gap in providing you with GIS support due to the delay in getting the GIS RFP on the street and the expiration of the Comtech contract. Okay. So what do we plan to do in 2021? Well, we have a few things that are going to be that are going to take up our time and efforts. First of all, we continue to focus on training. Our online training platform has been more successful than we imagined. We've had so many folks take courses on Virtual Academy that we were just amazed. We actually had to amend the contract to adjust for the number of folks that signed up and have taken courses on there. And we'll continue to grow that resource. Like I mentioned earlier, Jameson Peavyhouse has left the training coordinator position, but we will be filling that position. The state had a hiring freeze on due to the COVID-19 pandemic and the budget constraints that it placed on the state. But we have recently, at the end of last month, got a waiver for that hiring freeze, and so we're now in a position where we can start advertising for that position and interviewing candidates. And we hope to have somebody in that position in January. Okay, next slide. So if you take nothing else from this webinar, please note that after January 1, the Comtech NOC will no longer be the resource to call for any issues. Our contract expires on January 16th, but the NOC is winding down January 1. So you cannot open tickets at Comtech or call the NOC after January 1. What we need you to do for any network issues is contact the AT&T Resolution Center directly. And we have that number posted here. That number is also posted in any NOC tickets that you have open. They've put something on there, and Eddie has sent out several communications regarding that, the termination of the Comtech contract and the winding down of the NOC. But if you have any questions, contact us. Now, this will require for internal issues that you may have with your CPE that you contact your vendor directly rather than opening a ticket with a NOC and then having the NOC contact somebody. So we will be reverting to that. But any sort of network issues, please contact the AT&T Resolution Center. If you have any questions on who to contact, feel free to contact me, contact Eddie, and we'll get you pointed in the right direction. Okay. And then our other activities. We'll be launching TDMS, which is the Transitional Data Management Services. This will help ECDs transition to a geospatial MSAG from the legacy tabular MSAG. It will also allow districts to use their GIS data as the master, and AT&T and Trado will do the data management necessary for loading the ALI LDB. This will roll out on a gradual basis, and training will be provided. Be on the lookout for some messages regarding TDMS in January. We should have something out there for you at that time. We'll also continue our transition to the nationwide solution from AT&T. About 68 PSAPs have transitioned, and in 2021, all PSAPs will transition to the nationwide solution. We're hopeful that all of the call handling vendors will complete testing with the AT&T and Trado lab so that all deployments will be finished as soon as possible. Just a note for those that don't have their equipment tested or ready, we will be deploying gateways at your site, which will allow you to come onto that network. But we hope to have everybody tested and transitioned as soon as possible. We have been working hard to release the RFP for the NG91 2.0, and after that's released, we will have a lot of work to do to get through 2021. Essentially, what we will be doing is evaluating the responses to the RFP and selecting a vendor. Once we have done that, there will be some contract negotiations that we will have to do, which may take quite a bit of time. The reason we're having to do this in 2021, though, is that transition period. Should someone else win the RFP other than AT&T, there will necessarily be a time where we will have two networks up and running, and we'll have to roll PSAPs over from the AT&T network to whoever the new vendor would be as a result of that RFP. So we do need that transition period, and we'll have a period where we may see two networks up and running in Tennessee. We'll have the GIS contract and hope to have that as soon as possible, which we anticipate to have at the first quarter of January 2021. The cybersecurity assessment project. Since the National Highway Traffic Safety Administration and the National 911 Office approved our NG91 grant proposal in early 2020, we've completed 56 assessments. These assessments really kind of help districts assess their cybersecurity gaps. Cybersecurity has become critical in an NG91 environment because all systems are now interconnected, and we have seen within Tennessee locally some folks that have had some issues with cybersecurity. Nationally, it's been a huge story affecting public safety. So we really encourage you to take advantage of the cybersecurity assessment that's out there right now. It doesn't cost you anything. It's paid for through that grant. And then we hope to do some PSAP visits. You know, we've been locked down since March, essentially. So we enjoy hearing from you and visiting your sites. And as soon as we're able to, we will come visit. In the meantime, we're always available in any other way to support you. You can contact any of the staff members. We have attended some board meetings by Zoom or other means. If you need us to attend your board meetings, we're still available to do that. Don't hesitate to reach out to us. Right now, though, it's very difficult for us to travel, especially if we need to travel overnight. But if you need to get in contact with us, please feel free to do that. We're here to serve you. That's what our primary job is to serve the emergency communications districts. So anything that you need, please reach out to us, and we will try to get you the resources that you're requesting or need. Okay, and with that, I believe we've come to a period of questions and answers. We may have more questions than answers, but let's see if we got any out there. Molly, do we have any?
Yeah, sure. Yeah, so some were submitted in advance. There's one that was just submitted, bear with me as I read it. Why are we moving away from the NOC back to what we used to do? This is adding more steps for issues.
Yes, it is. Until we transition to a new vendor for NG911 2.0. The reason that we're moving away from the NOC is because the board decided to transition to AT&T's nationwide Esinet, and the Comtech contract is expiring. When the board decided to transition to the nationwide Esinet, there really wasn't a need for Comtech any longer. Comtech has been a very good partner for us, but they, as the contract was expiring, we did not see a justification to continue that contract. And of course, they ran the NOC. Now, we do have the AT&T Resolution Center that you can contact, but for internal things with your CPE, you'll need to contact your vendors directly. And it really is kind of a matter of during this transition period, not only would the Comtech NOC simply turn around and call the AT&T Resolution Center for any questions. So it's really eliminating a hop there and getting a response when it comes to anything regarding 911 connectivity. But you will need to go back and contact your vendor for anything that's on premise.
Okay, thank you, Curtis. Another question that came in is regarding TCPR. So the question is, when will the final copy of the TCPR policy be available, and when and where, can we find it? And then the same question regarding the operational guidelines.
Okay. Well, we have to, the law actually requires the board to promulgate a rule. So the board approved the proposed rule at its last meeting. We have to go through the rulemaking process now, and we're currently doing that. That takes a little bit of time. So what we're going to have to do is have a public hearing. Then we'll have to go before a legislative committee to get approval of that rule. And we're working on that right now. We can provide you with a copy of the proposed rule, but we won't have that proposed rule finalized and approved by January 1. So right now, what we need to rely on is the requirements contained within the statute. But the board does have a proposed rule out there. We can certainly provide anyone with a copy of that. I think it may be on our website. If not, it will be soon as part of the rulemaking process. So we will have a public hearing. If you have any concerns regarding the rule, the proposed rule, please be on the lookout for the notice for the public hearing. Just to let you know, though, that proposed rule did go through not only the training committee, but the operations committee. So it has been vetted by folks that will be dealing with it on a day-to-day basis, as well as the board.
Okay, thank you, Curtis.
Mm-hmm.
Let's see. Another question that came in is just acknowledgement that we're seeing costs from our vendors for text to 911 and helping establish connections to the Esinet. Can you talk a little bit about this?
Yes. So for text to 911, text to 911 is really part of our NG911 solution. So there's really not a cost on the network side, although your vendor may need to come in and actually turn that feature on for you or update your software for text to 911. So it's available to anyone over the network right now, but you may have some things that your vendor may need to do based on your specific equipment. As far as connecting to the Esinet, I'm assuming that means the transition to the AT&T Esinet. And when we discussed that, when the board made the decision to do that, AT&T was upfront that there may be some costs involved. And I understand that can be frustrating for the districts that they may have to have their vendor on site when that transition is done. I do think, though, that the board has provided some resources out there for the districts to actually cover those costs. So in July, the board provided $15 million to the districts, basically to bridge the gap from July to January, when the new $1.50 rate will take effect. And then this past meeting, in the November meeting, the board provided another $9 million in Section 130 funds, which we normally see at $3 to $4 million. So I think the board has provided some resources out there that districts can utilize for those costs. And I think it's also important to note that when we were making our case to the legislature for the rate increase to $1.50, one of the things that we were saying is Tennessee's always been a leader in 911, and we want to maintain that status. Well, in order to maintain that status, and in order to provide the best service to the citizens of Tennessee, we need to continue to advance. And I think that when we made that case to the legislature, there's an expectation out there that we will continue to move forward with the NG911 project, and this transition is part of that. So, I think we've given some resources, and I think that we've made some promises that we will continue to march forward with NG911, and I'm certainly available to answer any questions that you may have regarding your vendor involvement. Eddie's also available to answer those. I know that he's fielded a ton. He normally sits on those transition meetings, but we do need to continue that transition, and we would like to get it finished as soon as possible. Basically, we're going from one network that was cobbled together before any sort of NG911 standard was put on paper at a national level, to a network that will allow us to interconnect with other states and will provide additional functionality for us that our traditional NG911 over Net 10 network just simply doesn't do. I hope that answered the question. But if you have additional questions about it, feel free to reach out to me personally, and I'll be glad to talk to you, or reach out to Eddie.
Okay, thank you, Curtis. There's another one here. Basically, is the TECB anticipated to address reviewing the 911 surcharge distribution to factor in the new 2020 census data for each ECD? There were a couple of questions that came in regarding this, the growth and funding.
Well, so that takes a legislative change. So the board cannot adjust your base funding, which is why when we met last, we created an operational substitute to get the money, the additional revenue that will come in from the $1.50 surcharge back out to the districts directly. So that money, that increased revenue is going back 100% to the emergency communications districts for operational purposes. As far as how the base funding goes, though, it's really set in statute. So it would take a legislative change for us to do that. Now, I do think that the 2020 census will show that some areas of the state have grown dramatically. I know that where I'm at in Wilson County, in my neighboring county, in Rutherford County, we've had just a tremendous amount of growth. So at some point in time, I think the legislature will have to take a look at that, and we can certainly provide them with some very good information beyond the 2020 census for them to make any sort of decisions on adjusting the base amount. But it does take a legislative change. Now, we are very good at gathering data, and Jim Barnes has a ton of data about costs based on your annual audits So we can provide that information for them to make an informed decision. I think we also have some committees meeting, the policy committee as well as the operations committee that are looking at revenue standards, that are looking at what it actually costs to run 911 in Tennessee or run a PSAP in Tennessee, and that work is very, very important for any sort of decision that will be made regarding adjustments in base amounts. So I think having those really sharply defined revenue standards, what you must use your money on, what you can use your money on, and what you cannot use your money on, is important when we're taking a look at adjusting the base amounts, as well as the work that the operations committee is doing in taking a look at, okay, what does it really take to run a PSAP here in Tennessee? And maybe we're not where we're to. We haven't really defined if we're going to look at a 2-position PSAP or how we're going to look at that. But it's work that the operations committee is doing. Both of those committees will be meeting again, I believe, in January. We haven't finalized dates for those yet, but both of the chairmen of those committees have reached out and said that they would like to meet. I just don't think we could squeeze it in December with everything else going on. So looks like they'll both be meeting in January to continue that work, and we will have some really good information for the legislature if they decide to take that issue up.
Okay, thank you, Curtis. And before, we have 2 more questions at this point. And before we get into that, I'd just like to remind you, you can raise your hand and I can unmute your microphone. Or if you'd like, you can submit questions through the questions box. This next question is around, again, going back to TCPR. So will the TECB be providing CPR guide cards for TCPR like is done in EMD? If so, where would we get those? And if not, how do we get a written guide for TCPR questions and instructions?
You know, that's a very good question, and it's not something that we've considered. So at this point in time, no, we haven't planned to provide or haven't considered providing guide cards for TCPR. It's something that that maybe our training committee can take a look at. I honestly don't know what those would look like at this point in time. The only thing that I can refer you to is the TCPR course on Virtual Academy. So I don't know. We'll take a look at that. I'll address that when the training committee meets and see if we can do something. There are issues that may come along with that. There are companies out there that provide TCPR training as part of the EMD right now. I was on the phone with somebody from one of our districts before this webinar, and we were discussing the very same thing, that their CAD essentially has a drop-down menu where they can take a look and go through the TCPR questions. But as far as providing actual cards, that's not something the board has considered at this time, although we may do that in the future.
Okay, thank you, Curtis. And it looks like we have one more question, and this one is regarding vaccination. So is there any information from the state health if 911 ECDs are included in any vaccination order for the state of Tennessee?
Yeah, so I've gotten this question a lot over the last 2 weeks, and the answer that we've received is that 911 personnel are not in the initial round of the vaccinations. That will be for folks that will be essentially touching other people, that come in direct contact with people. So while we have made the case that we are the first responders, and those responders can't get to those other people without us, and our PSAPs are seeing a dramatic decrease in personnel due to COVID-911, we have not been able to move the needle on that. And the answer that we get is no. It's 911 personnel are not going to be included in the initial round. We don't have information on the subsequent rounds, though. So we at this point in time, we simply don't have any information as to where we will fall in the order of providing those vaccinations. But we try to make the case. We were rebuffed by the administration, the Department of Health. Their focus right now is actually on folks that come in that have the potential to come in contact as part of their job with others that are positive for COVID-19. You know, I've explained that 2 of our staff members out of 7 have contracted COVID-19. We have a board of 9, and at least 2 of those members have contracted it. We know that some PSAPs are working on 1/3 of the staff that they normally have. So we've tried to make the case, but just haven't been able to make a dent in that firm decision. There's been some talk, and I haven't checked the news today, but there's been some talk about it next going to nursing homes and the extremely vulnerable population. I wish I had better news for you, and I wish I had more news for you about where we fall, but I just don't have that. I can tell you that we made the effort to get us into that initial round and just simply couldn't move the needle there.
Okay,
it's kind of ending on a down note.
And just kidding, I do have one more question that also came in while you were talking. Do you have information you can provide on the legislation that was proposed last session? And do you know if the information gathered by the comptroller's office earlier this year was for that legislation?
No. So we do expect some legislation to come back. I'm assuming you're talking about the question was referring to the direct dispatch bill that was out there last year. My understanding is the sponsor is determined to bring that back, although bills are being filed right now. Every morning we get an email letting us know which bills have been filed for the previous day, and we've not seen anything filed so far. And we have not received any information from the comptroller about their information gathering efforts. They have not contacted us. We do have a representative of the comptroller on our board, but he was not involved in that, and they probably put a firewall between him and those information gathering efforts anyway. So we do expect to have some legislation proposed this year. But just to let you all know, this is a sunset year for the board. And so ideally, we would like to have no 9/1 legislation this year and just make sure that we get through our sunset process. We've already gone through one hearing for our sunset, and we were given a recommendation for 4 years. However, if you were to take a look at that meeting and go back and watch the meeting, you'll see that this came up even during that meeting, not by the bill sponsor, but by another representative. So there was a big spotlight on 911 last year with the $1.50, and then some other issues with the direct dispatch and some legislation about 911 districts, the emergency communications districts actually covering the cost for all personnel that works in a PSAP. So we expect to see some of those again this year, but we would hope that we really hope for a quiet legislative year. I don't know that that's going to be possible, but that's what we're hoping for.
Okay, and I think that looks like that's all that has come through. Did anyone else have anything they'd like to ask or share?
Molly, this is Benjamin Glover. Can everybody hear? Can you hear me?
Yep, we can hear you. Mm-hmm.
Okay. Just with regard to the vaccine stuff, I had a conversation with an assistant commissioner at Department of Health last week. They're going to be doing weekly updates with regard to the vaccine rollout plan. So my suggestion to everybody is to keep an eye on their website, see if you can get some sort of notices. I think they go out every Thursday. So every single week there will be an update to the vaccine rollout plan and how it's going and any changes to it. So if we were to see anything, that's probably where we're going to see it there first with regard to 911. That's all.
Great. Thanks, Ben. Well, no more questions have come through. So, Curtis, I think that's it. Any other closing remarks?
No, I just want to say thanks to everybody that joined us by the webinar today, and also just thanks to all of our folks in 911. It's been a tough year for everybody. And as always, you guys go kind of unrecognized as the silent heroes in Tennessee. So I certainly appreciate it. The board appreciates everything that you do, and we're here to help you with that. So any resource that you need, anything that you think we can help you with, let us know. That's our, like I said, that's our primary function is to provide services to you. But I really want to say thank you for helping Tennessee get through such a difficult year. You all are amazing. Every time I go somewhere and meet with 911 folks, I'm just amazed at what they do, how they're able to do it, the professionalism that you have. And I'm really proud of what we have here in Tennessee. So thank you. And if we can do anything for you, let us know, and just continue the good work in 2021. And hopefully we'll have a much less difficult year than we did in 2020.
All right. Thank you very much, Curtis, for sharing everything. And thank you, everyone, for joining. That concludes our webinar, and we wish you all happy holidays. Thank you again.
Thank you.